the inside of your nose gets swollen, but to some extent you can't tell, like you get by, right? So if you can't breathe through one side, you'll breathe through the other. If you can't breathe through the other side, you'll start to mouth breathe. When you move to a new place, have a honeymoon period, like you move to a new place and all of a sudden you're like, wow, I feel great, because you're not sensitized to the allergens yet. It takes like 3 to 5 years.
So when we come in contact with an allergen, we talk about allergy season. What's going on in these like periods? Obviously we talk about pollen production and some of those things, but is there more to that story of like what's going on during these times of year when allergies are really bad? Hey everyone, Derek Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. Good day, my friends. Welcome to the Pain and Performance Podcast. This is one of those like perfect timely episodes. This time of year, a lot of my patients come in and they're dealing with allergic symptoms, allergies, dealing with medications, and we're trying to figure out what to do. Do I take an antihistamine? Do I do nose sprays? So I wanted to bring on someone who could help us with this. So we got Dr. Shuba Iyengar, who is the CMO of Alarmy, a company that does compounding, but she's really a wealth of knowledge of like what causes allergic responses, what does our body do when it comes in contact with allergens, what medications should we take, what medications should we stack, which ones should we be combining, and some of the ones that we should be avoiding. This was a really good episode that gives a lot of action in terms of like what people could start changing very, very quickly. So yeah, if you know somebody who's dealt with allergies, I think give this one a listen. It's stuff that I think we've probably heard. To put all of this in one really good place where it kind of educates us and gives us some good insights into what's going on inside of our body this time of year. And I think you'll get a lot of action out of this. So please enjoy this conversation on allergies with Dr. Shuba Iyengar. Amazing. Dr. Shuba Iyengar, welcome to the Pain and Performance Podcast.
Nice to meet you.
I am excited. It is March. This will probably drop right in the middle of allergy season in South Louisiana. And I think if there's anything that my patients come in that frustrate them because they're like, I don't know what to do, it's whenever we're like just constantly fighting with allergic responses and allergens and headaches and sinus issues. So thank you, A, for what you do, but B, for teaching some of this stuff.
Oh yeah, absolutely. So many people suffer from it, like especially like March, April, May, like you said, it's awful. And I have allergies too, so I get it.
So growing up in Louisiana, I had very severe allergies as a kid, and I would love to get your input on this. I was gone from Louisiana for a long time. I had moved away. I was traveling, doing education, and I really did worry about moving back home to open the practice. Partly because of allergies. Like I was like, I remember how terrible it was to always be in this like kind of allergic irritation. And then I got back and I changed some of the things that I did from a treatment standpoint. And it like, I just don't really deal with it. Of course, good. Like around That's now good. You'll get a couple of sneezes and stuff from time to time, but to say we go into a full allergic response, I don't get that stuff. And it's obviously a blessing, but I don't know, is it time? Is it some of the changes that I've made? Can other people kind of tap into some of that stuff? Is it just being gone and you've kind of processed that out? So what's happening? I think it would be helpful for people to understand what allergies actually are and like what's going on inside their body whenever we're dealing with some of that stuff.
Yeah, to sort of answer your question, I'll go into like the whole allergy thing. I mean, your immune system is dynamic, like it changes throughout life. And so you'll see like it kind of undergoes these little resets as you get older. And so sometimes we see it a lot with like expected things like, puberty. We see it with, women get pregnant. It changes the immune system. Sometimes the allergies get better. Sometimes the allergies get worse. And for, other things, like sometimes it's hard to know, but like throughout time, your immune system kind of resets itself. And again, sometimes that's in your favor, which in your case it was, which is great, but sometimes it makes it worse too. And that might have been what happened. You also, when you move to a new place, have a honeymoon period. Like you move to a new place and all of a sudden you're like, wow, I feel great because you're not sensitized to the allergens yet. It takes like 3 to 5 years. I don't think that was the case for you because you had lived in Louisiana before, right? And then you moved back. So not sure what that was about, but I'm glad that worked out for you.
Yeah. Very, very nice that it went that way. So when we come in contact with an allergen, we talk about allergy season. What's going on in these like periods? Obviously we talk about pollen production and some of those things, but is there more to that story of like what's going on during these times of year when allergies are really bad?
Yeah. I mean, the way to think about it is that, when you get allergies, you're breathing in that stuff that you're allergic to, right? And it's causing your body to get inflamed. And at the very kind of core level, like the inside of your nose gets swollen, but to some extent you can't tell, like you get by, right? So if you can't breathe through one side, you'll breathe through the other. If you can't breathe through the other side, you'll start to mouth breathe. It's only when that nose gets really swollen, like let's say the pollen count's really high or you get really sick with a cough or cold, that nose that's already kind of swollen will swell even more. Sometimes it'll swell shut. And then all that mucus that wants to come out can't. So it starts to go backwards. And a lot of people feel it on the back of their throat, like, they feel like that little tickle or that postnasal drip, or it'll go into their sinuses and they'll get like the sinus pain and pressure. Or what can also happen is when that nose gets swollen on the inside, there's a tube or a duct that goes to the eyes. That tube gets really swollen and the eyes get really itchy. And so sometimes when you experience allergies, you experience all of that stuff, like the eyes get itchy or your sinuses start to hurt or it goes on the back of your throat. And it's not clear what it is. Sometimes you think, could I be sick with like a cough or cold, or is it allergy? Sometimes you can really feel super itchy, like you want to scrub everything out, and then you can kind of tell it's allergies, but sometimes it's hard to tell.
Yeah, so our body recognizes these allergens, whether that's like a pollen or, a mold spore or whatever it might be, as a kind of like foreign invader. Is that what starts the process?
So from a biological standpoint, what happens is that you breathe in this stuff, right? And then it binds to something called IgE, which is a protein that you make in your blood that's specific for things that you're allergic to. And it makes this complex, and then those complexes start to bind to certain cells. And in this case, it'll be like mast cells. So mast cells are a type of allergy cells that have all these chemical mediators in them. And when these complexes bind to them, it causes the cell to kind of burst open, like what they call degranulate, or secrete all these chemical factors. And among those factors are like histamine, leukotrienes, different chemicals that cause the allergic reaction. So that when you get allergies, you start to get itchy, you might get swollen, it might get red. All of that is because of those chemical mediators that are secreted from these mast cells or these allergy cells.
And that ends up leading to kind of some of the medication stuff, right? Like as we look at that, you're like, okay, I was trying to break this down and looking at where in this cascade we could affect it. So in one part of it, it's like, how much does your body recognize the allergen as a problem? Mm-hmm. And I think, I don't know how much that response could be changed. Is that what allergy shots are trying to do?
Allergy shots, it's a little more complicated than that. I mean, it's a good principle, but at the very core, allergy shots are basically kind of training your immune system to become less activated towards what you've been allergic to. And to do that, it kind of goes down to the T cell level. So you have different cells in your body that participate in this process of allergies. One of them are your T cells, which are a type of white blood cell, which kind of does a lot of things, but it helps in especially what you call your adaptive immune system, your body's ability to remember things that maybe it was infected with in the past. And it's almost like a library. It forms like a library of memories, where that if you get infected with it again, your body will be like, I know that infection, I'm going to react to it right away. So T cells are part of the adaptive immune system. And when you do allergy shots, in part, you're kind of training that some segment, your T regulatory cells or cells that are part of that system to like kind of like kick in and stop, and recognize that this is not something to react to anymore. It's something that you're going to be okay with. And so in a very basic way, that's what allergy shots does. It trains your immune system over time to stop reacting to something.
So we're going to just take a moment and get into the weeds for a second with this. So if we live in the same place and we come in contact with, that area's kind of, allergens, why doesn't our body do that to begin with? Like if it's coming in contact with frequently the same type of allergens, you live in an area that has lots of ragweed or whatever, and you grew up in that area, like where is our body missing it that it's not kind of learning about that allergen to begin with if we're always around it? Does that make sense?
Being around something doesn't mean you're going to react to something, because we are around lots of things, right? All the time. And we don't necessarily react to them. So there is a process that's sort of, somewhat understood, but somewhat not understood as to why. I think your question is like, why do we develop allergies towards some things and not others? Right? Is that your question?
So I think, from my understanding, like, you're trying to train the body about how to respond better to this allergen, right? That we're
how to not respond to that allergen. Because right now what's happening is when you breathe it in, you are getting inflamed everywhere. And we want to, and by giving so allergy shots are when we give small amounts of something. Usually it's once a week for about 6 months to build up to a top dose. And then it's once a month after that for, close to 3 to 5 years for a lot of people, sometimes even more. I've been on shots for like 14 years, so it's a long time. But usually after getting that, usually after about a year, we're able to cut meds in half or go off of them completely. And usually after 3 to 5 years, you're done. Like your immune system develops this tolerance towards this stuff. And that's because you're giving small amounts of it. It's what they call a tolerance protocol. You're giving a small amount in a certain way over a long period of time. And that is training your body to get used to it. But it's very particular to the amount, the escalation, and the way that you give it.
I got you. So that's probably why, like, even though you're constantly coming in contact with the same allergens, it's such a high dose, your body can't acclimate to it.
Yeah. The way I want people to think about it is that when you're inflamed, everything is snowballing, right? When you're already inflamed, it's so much easier to get more inflamed. And so when you're already inflamed, it's easier to get sensitized or to get more allergies towards something because that inflammation causes more permeability in the barrier. There's lots of inflammatory mediators there. Everything's already there, right? It's kind of like setting you up for like not success. Right. And so that part and parcel kind of contributes to why people who have allergies get more allergies. And the one question is, why do people get allergies to begin with? That's a very complicated question. But I think for a lot of people, it's in essence tied towards what they call your mucosal barriers. Like some people say, there's a lot of hypotheses out there that little babies, when they're born, if the barrier becomes their skin barrier, it doesn't. For some kids doesn't work as well, right? And so a lot of times there's thought that permeability of the skin, if kids get sensitized through the skin to foods before they eat it, that might set the immune system up in such a way that they're more likely to develop food allergies, maybe towards certain particular foods that they came in contact to through the skin before they actually ate it. Because there's different types of tolerances. There's the dermatologic tolerance, and then there's the gastrointestinal tolerance. And sometimes that dynamic can get changed very early on in life.
Yeah. Is it the same? So, we look at some of these studies around like food allergies, and coming in contact with those things earlier in life seems to be more
early
beneficial,
introduction.
Right?
Mm-hmm.
Is it similar with this type of stuff? Like, should we be taking kids? I don't want to completely derail us, but it's an interesting. Yeah. Should we be going sit outside more? And like, should we be in these areas with younger kids as their like body is setting up and learning about all this stuff?
It's really hard because some kids are just more prone to getting allergies than others. and you put them in that environment and it's like the opposite of what you want, right?
Yeah,
They start getting inflamed, sneezing, everything, right? So
you also have to stay sane as a parent. So
I know you do. It's all about survival as a parent, right? You're just trying to get there. You're trying to survive. I think that it depends on the kid. Like some kids, yes, you can do this early introduction. You know, if they don't have like many risk factors, you know, they're not showing like big signs of allergy, you can introduce like small amounts of those allergenic foods when they're infants. They do great. Rock star, you know, hopefully they don't develop any food allergies. You know, you're in a good place. But some kids, you give it to them and they react, right? And then you have to think it's a totally different case for those kids. They end up seeing allergists, you know, like me. We end up doing testing and then we try to figure out, okay, what foods do they need to avoid? What foods can we introduce at home? And then what foods do we want to do food challenges to? Food challenges are special kind of visits. They book out a few months in advance and we give them small amounts of, let's say, peanut butter every 15 minutes for 1 to 2 hours. And if they do okay, then they can eat it regularly. And again, the advantage of eating something regularly is that they're less likely to develop a lifelong or sustained allergy to it.
I'm glad you brought up kind of some of those things. So because I do want to take a moment and go into like allergy testing. What are we looking at? How are we doing that? What information can we get from doing allergy testing? I know I've had a lot of patients that have this misconception of like, they're going to tell me I'm allergic to everything, like no reason for me to do that. So what are we doing when we're doing allergy testing and like, how do we use that information?
Yeah. So at the very core, I do allergy testing. Let's say we're talking about environmental allergens, right? For environmental allergens, one of the best tests to do is something called skin testing. Skin testing is a special kind of test that we do in the allergist office. It takes about an hour and we do it on the back. And so we put like little drops of different things on the back and then we take plastic and scratch it in and just wait and see if they get a bump. It takes about an hour and I use that to gauge probability. What is the probability that environmental allergens are triggering all of their symptoms? And then what's the best long-term plan? Is it to keep them on the medicine regimen that we have them on? Is it to think about the allergy shots that we talk about where we give them small amounts of what they're allergic to? Like what is the best thing for them? Yeah. And so that testing helps me gauge probability. So to some extent there's confusion because like we test for like 50 different, here in California, we test for like 50 different tree species and like all these different, like, you know, the different grasses, dust mite, cat dog. And yeah, they come back and they're like, oh my gosh, I'm allergic to everything. Like, what do I do? Right? It's overwhelming. Yeah. But, you know, remember, we're using it to kind of get a sense of like, okay, what can we do at home to decrease your triggers? What should we think about? You know, should we be mindful about things as you're going outside? Should we put you on a regimen of nasal sprays to really help bring down that inflammation? Down the road, should we think about allergy shots? Like, what should we do long term? And so that's what the testing really helps with.
Yeah, the kind of changes that can come from some of these things, look, in our patients can be life-changing. Like if this is something that you're constantly dealing with and you don't have a plan of how to overcome that, that's tough. Like you're constantly reacting, and everything we try and do with our patients once we get them healthy, if they show up with like a pain or an issue, is let's be proactive in a lot of these cases. Let's not wait until you're in a full-blown, pain issue, or in this case, allergy attack, to do something.
Yes.
That leads to my question. Like, I've never been allergy tested. I had bad allergies as a kid, and I don't know where that fell through. But who and when should we get allergy testing done?
Yeah, I think that, if allergies are really affecting you, right? And it's affecting your sleep. Because a lot of people, like when they get so swollen, right? You can't sleep at night because you can't breathe through your nose. If you can't breathe through your nose, you're going to breathe through your mouth. And all of a sudden, like you're snoring at night, right? Maybe your partner doesn't love that. And then on top of that, you're waking up because you can't breathe, right? And so for all of those reasons, it's worth getting tested because we need a long-term plan for you. Like this is affecting your quality of life. Like you can't do the things that you want to do outside. And so by getting that testing done, we can gauge like what is our best long-term plan. Should we think about nasal sprays? Nasal sprays are generally the best treatment for pollen allergies because they go right to the nose, right? When you're getting the swelling there, we can use medicines to bring down that swelling and to make it so that it doesn't spread to the eyes or it doesn't cause all that stuff to backdrip on the back of your throat. And there are different kinds of nasal sprays, which we can go into. They're the anti-inflammatory ones. They're a lot of the over-the-counter ones like, fluticasone, triamcinolone. These are what they call anti-inflammatory sprays. They're very diluted nasal steroids. And for the most part, we don't want you to worry about the steroid part. Like a day of a steroid by mouth is equal to months of the spray. It's like really, really diluted. But because it's so diluted, when we use it by itself, it takes a long time to have an effect. And so we almost always add on other sprays. So sometimes we'll add on like an antihistamine spray, like Azolastene. That one works to counteract the histamines. And you feel the Azolastene right away, but it doesn't last very long. So combining these ingredients are really helpful because some work really fast and some work really slow, and they go right to where they need to, which is the nose.
So can we dive into Azolastene? Because I've heard you talk about that one quite a bit in research, and how it's like that one is much better because of the way it's reacting just in the nose, as opposed to like, I think maybe doing it through shots or something like that would cause like the whole system to respond to it. What's the effect of Azolastene?
Azolastene is an antihistamine, so it works on the histamine receptor. So when you get inflamed, your mast cells, your allergy cells secrete histamines, which cause like the redness and the itching. And so it blocks at that receptor site. So it helps prevent that chemical from causing those kind of symptoms. But in practical terms, Azolastene is very fast acting, so you feel it, but it doesn't last long. So when people use it, they're like, I used it, but it didn't do anything. Like after 2 hours, like I felt bad again. And like, what do I do? And so that is the beauty of combining different ingredients and using them at the same time. And so, at Alarmy, where I'm the CMO, we were able to do that, which is awesome. Where we're able to combine different ingredients depending on people's symptoms. And then we can figure out, okay, what is the best combination treatment for them, and kind of address all those different symptoms so they don't feel like things just like work for like a couple seconds and then they're like gone in a hot second. Like it really does have like a longer lasting effect, which is nice.
Yeah, look, the way my brain works is it's a stacking. Can we make things better? And so when I was kind of studying how y'all combine some of these things, it was like, okay, I'm on board. These people get it. So when we're working with those, what I'm hearing in some aspect would be that we probably want to be ahead of the curve with some of that stuff. Like we would want to start that before we start to get significant responses. Like the first time we're starting to be like, I got a little bit, and we would want to stay fairly regular with it, right?
Yeah. So this is the issue with nasal sprays and why some people feel like they don't work well. Because let's say like you wait a while, like you're like, oh, it's like March, still raining here in California. Like I don't really need to do anything yet. And then you kind of wait it out. The problem is that even though you feel like nothing's happening, like you feel good, your nose is probably getting more and more swollen, but you just can't tell because you can compensate. Again, if you can't breathe the one side, you breathe the other. If you can't breathe the other side, your mouth breathes. And then all of a sudden it swells like almost shut. And now you're like, I feel miserable. Like, what am I going to do? Right. And then you try doing the nasal sprays that you buy at the drugstore and you're like, it's not working. So then you start popping pills, right? You start popping the antihistamines like the Claritin, the Zyrtec, the, Allegra, and then you feel better, but it doesn't make the problem better. And then you're like stuck. You're like, what do I do? Nasal sprays aren't working. I'm switching on and off of all these little like pills and it's not working. So, what we do at Alarmy is among the different ingredients we have is we have a small, like we microdose oxymetazoline. Oxymetazoline is a decongestant, and at full strength, it could be associated with some side effects, when you buy it at the drugstore, because it can cause rebound symptoms or rebound medicamentosa. It can sometimes irritate the nasal passages, but we use it in microdoses. And when you combine it with an anti-inflammatory, and studies have shown this, it mitigates a lot of those side effects. So in addition to like microdosing it and combining with an anti-inflammatory, you pretty much get rid of a lot of the side effects, which is great. But in addition, because we have that small amount of that decongestant, we can open up the nose, even though it's really swollen, and the other ingredients can get back there. And so that's why it's effective in people who maybe have tried other things and it hasn't worked as well, or they've waited a while before starting something, because we can really get those nasal spray, the other ingredients to really get back there into the nasal passages.
Yeah, that's brilliant. We do, this is for like a completely separate issue, but we do endonasal balloon therapy. Are you familiar with that? Where you'll do like an endonasal balloon to improve the joint mobility around the facial structure, the facial bones. And I've had probably 50% of my patients that have had that done will come back and say like, man, my sinuses feel better. My allergies feel better. And it was always like, does that just reduce inflammation? You're getting that area healthier. You're improving nerve function and blood flow throughout all of the kind of facial structures, sinus structures, airways. And I wonder if they're just able to get, some of these medications into areas that were kind of like swollen shut before, and you open up some passageways, because that's in essence what you're doing. You take a balloon and you go through the 3 passageways.
You're just mechanically just opening everything up. That's pretty cool.
Very interesting. It was just, it's an observation they see, and I'm like, look, that's not what we're treating. So keep doing whatever you're doing. What are some of the, so you mentioned some of the over the counter stuff, and that was one of the questions I got a lot in asking our followers about this. Hey, what's y'all's questions is like, which ones should we steer towards if I'm going into, the local kind of drugstore?
Yeah.
Which over the counter ones actually have some validity? Should we combine over the counter nasal sprays?
Yeah.
So what's your thought on some of those things?
Yeah, there's a lot of stuff out there. It's super confusing, right? Even when I go to the drugstore, I'm at Target or whatever, or Walmart, and I'm like totally lost, right? So there's so much stuff. But the pills will make, most of the pills are antihistamines. So they block at the histamine receptor, which means when you take them, you feel less itchy, right? Which is good. But again, for pollen allergies, it doesn't address the problem, which is in the nose. The problem is that also these pills go everywhere in the body, right? They're what they call systemically absorbed. And so you can feel a lot of side effects, like especially with some of them, like Benadryl. Benadryl is the worst, right? I mean, it has its own purpose. I shouldn't say that. It has its own purpose for like especially if you're trying to treat like allergic reactions and, you want to treat it really fast. Liquid Benadryl is very helpful for that. But when you're having bad pollen allergies, liquid Benadryl is like the dinosaur medicine. Okay. It's been around since the 60s. It will make you feel sleepy. It will make you feel groggy. It will make you feel drowsy. That is the one I say, like, definitely steer away from. You don't need that, right? Who needs that right now? We have so many things we have to do. The Zyrtec, the Claritin, the Allegra, the fexofenadine, all that stuff, are second generation antihistamines. They tend to be cleaner, which is great. Less side effects. Zyrtec probably is, or I want to say, cetirizine is probably tends to be the most effective of those. As allergists, that's what we usually think. It helps a lot with itching. But in 1 out of 5 people, it causes them to feel a little sleepy. Xyzal, which is a slightly different chemical structure, which is also on the over-the-counter market, probably is less likely to cause people to be sleepy. But at the same time, you're still taking something. It's going everywhere in the body. It's just treating the itching. So then we say, let's steer towards the nasal sprays. Yeah. So if you're going to steer towards the nasal sprays, definitely you want to think about an anti-inflammatory, like the, Flonas's, Nasocorts. Those are really good. But again, when you use them, you're not going to feel it right away, right? Because it's going to take a while to kick in. So you have to do it every day for a week or two for it to kick in. So combining that with like an azolastene, right, is helpful because the azolastene will work right away, whereas the anti-inflammatory like the triamcinolone or the fluticasone will take its time to kind of kick in. And so combining those two is helpful. I would say like avoid fluticasone. I always tell people, this is bad, but like I say to avoid the green color Flonase because it has alcohol in it and it's super irritating and it smells like flowers. So you can do the other ones, but just avoid that one. The Flonase Sensimist, much better, less, doesn't have alcohol in it. The distribution system is better. Kids like that one because it feels like a puff of air. But yeah, combining those two classes is probably going to be the most helpful.
What during this? What about kind of like saline rinses and stuff, and all of those things? Where does that fall into this? Should people be doing that? Should we leave those alone?
I do it every day. I just did it before I got on this podcast. Saline rinses basically will like rinse out what's in your sinuses, which is really nice. And I tell people to do it before they do their medicated nasal sprays because it'll wash everything out. Problem is like when you do it by itself, it's not going to bring down the swelling, right? It's just going to wash everything out. So you still need the medicines. You still need the medicated nasal sprays to bring down the swelling. But the saline rinses are really helpful, like in just like, because you know, when you wake up in the morning, all that stuff gets gunked into your sinuses. So you wake up and it's like this explosion of stuff trying to come out. So using a saline rinse first to kind of get everything out is super helpful. And I usually tell people to do it like in the morning or at night.
I do. This is where I've started working that in is like I do a lot of this time of year work outside. I do quite a bit of hunting and stuff like that. So we'll be out there and we're cutting trees down. And I'm sure you've seen these videos, but like I was watching a video yesterday of a woman who's like, she's walking her dog through this bush and the pollen is just like this giant cloud. And that sticks in my head when I'm like out in the woods cutting trees down and stuff. And I'm just like, it's got to be everywhere around me. So if that just sits in there any longer than it needs to, that's got to be bad. This is my amateur mind on this. So I've started, if I spend a day outside around this time, I'm like, let me just rinse it. Like rinse it that night.
Yeah, it is helpful.
Whatever's in there, let's get kind of a fresh start so that when I go to sleep, I'm not just letting that kind of sit in there and kind of irritate things all night.
Yeah. You know, I really like the pressurized saline too. We include it with our Alarmy medicated nasal sprays. Pressurized saline, they come in these like little metal cans. Yeah. And when you use them, it feels like a mist is going up there. It doesn't feel like water, like a squeeze bottle, like shooting up there. And so I tend to like those much better. So if you have a choice, those tend to be really nice.
So let's kind of at least touch on this. So what can we do throughout the year that helps to improve some of this stuff? So like, of course, like we're getting to this point. I love what y'all are doing in combining these things in the right amount. So, you know, if you're listening to this and you're in this, definitely check Alarmy out. Y'all match with the way I think about these things. Is there other stuff? What's the full year? Is there benefits to the immune support, the quercetin, the glutathiones?
You know, the way I think about it myself is that you have a glass that's full of protection, right? That protects you against getting like allergies or inflammation. But there are things to take away from that, right? If you're sick with a cough or cold, sometimes you pour some of that out, right? If you have like certain things like an impaired skin barrier or you're just more prone to inflammation, you pour some of that out. If you like have constant exposure, you pour some of that out. So somehow your glass gets half full and you want to kind of build it back up again. So one thing to think about is like exposure means that like, yeah, people are like, you know, what does it mean? Is that I can't go outside? I can't do the things I want to do? No, go outside, do what you got to do. But remember, like there are certain like really key things that you can do. Like number one, windows closed in the bedroom. I can't tell you how much of a difference that makes, right? Because when you open that window, all that pollen comes in, it gets all over your bed, it causes you more symptoms, and you spend a lot of time in your bedroom. I mean, we don't spend as much time as we want to sleeping, but like we still spend a lot of time in there. And so it gets all over, it makes you more sneezy. Number one thing to do. Number two, taking a shower at night is really helpful to, kind of keep the pollens off. Shoes at the doorway really help too, so you don't drag the pollens in. But that number one thing is that bedroom window.
What, you brought this up, we just did this not too long ago, air filters. Is there any like filtration systems that you have looked at that you like that actually help pull pollen or allergens out of the air?
A lot of my patients tell me that they really like having an air purifier in the room. I usually just recommended like a HEPA certified one. There's so much access out there to so many different ones. I don't want I don't have people have to spend like all their money on one of these things because you can go crazy with it, but just like a basic HEPA certified, air filter in your bedroom that you remember to change the filter out every couple months. Everyone always forgets to do that, right? You got to remember to change that filter out. That is helpful for sure.
Doc, I'm glad you said that. I think we might be getting close to needing to change ours. That's the both of those I think are extremely, I have learned, I think everybody listening to this, like if I'm outside, if I have to take a shower, somewhere along the way I heard that like hair like product, hair gel or anything like that, almost like held on to like pollen. And so
Oh,
if you
interesting.
slept with it, it would like leave it there, and that got
Ew.
stuck in my head. So it's like I have to take a shower before I go to sleep, or I will wake up and like, you just feel it, and
Yeah.
you're on the road to that cascade. At least you're speeding it up in some way.
Yeah, it's the bedroom. You really got to think about your bedroom. It's like it has to be your sanctuary, right? Because you're spending a lot of time there. So whatever you can do to get that bedroom, the rest of the house I don't care about. Just your
The
bedroom.
bedroom. This is a very random one, but I have to ask it. Pets,
Yeah.
pets. And you're talking about bedroom. How do you think about that stuff? Like
You
pets in the
know,
bedroom, pets in bed. Um,
people always come to me and they're so worried. I can tell when I do the testing because they're worried that it's going to say that they're dog allergic and they have a dog and I'm going to tell them to get rid of their dogs. I never have had anyone have to get rid of their own pet. Most people will tolerate their own pet. It takes like 8 to 12 months, but you end up developing tolerance towards your own pet. Other people's pets, different story, right? So you
yeah.
go over someone else's house with a dog or cat. Sometimes, yeah, you can get like itchy eyes, itchy nose, runny nose. Using your nasal sprays before you go, like twice a day on the day that you have this, like you're going over someone's house with a pet is helpful. Also, like washing your hands and changing your shirt when you come back, that's super helpful too because those allergens stick to your clothing and things like that. But again, most people will tolerate their own pets. If someone's gonna get a pet, they always ask me like, "Oh, what pet do I get? Can we test for that pet?" I wish I could. We're not there yet as far as technology. But what I tell people is like, try babysitting like different breeds of like animals, like dogs especially, to see what you do well with, because that kind of is a really good indication of how things are going to go. And so that's really helpful. So a lot of people will do that too. If you're starting out, like if you're just getting a new pet and you can try to keep the pet out of the bedroom, that is super helpful. Running an air purifier is super helpful. If you already have a dog or cat and they're already sleeping with you, that's gone deal. Like it's not going to change that, right? Nothing's going to happen there. But running an air purifier is helpful. Washing the sheets in hot water, every week is helpful. All of those things help.
Yeah, I'm with you. I don't know that you can get somebody's pet out of the bed once they're already in the bed, but if you can start from the beginning and not do it, I think there's more positives than negatives for you and your pet, everyone listening. Sarah. Um,
That can be extrapolated to a lot of different like things in life.
Absolutely. Dr. Shuba, this is great. I think lots of actions for people to take, especially this time of year. Y'all make sure you're kind of going back and putting some of this into action before you get into some of these kind of inflamed, irritated states, because the trickle down effect into your other areas of health, that could be a whole other conversation. That this really impacts a lot of different areas.
Yeah, it's a snowballing effect. Like once you're inflamed, it's really easy to get more inflamed. I just want to say like there are like a certain group of my patients where they have both allergies and they have autoimmune issues. And they're my special group because they are so sensitive to any inflammatory trigger. So for that group, what I've heard among my patients is that really cutting down like inflammatory triggers, like including like a low inflammatory diet is super helpful. So that's something to think about if you have like both autoimmune issues, like, psoriasis, thyroid disease, lupus, arthritis, plus allergies. Definitely think about like low inflammatory diets. A lot of people really benefit from those.
Yeah, that's super helpful. Certainly, we have some lupus patients that I would agree with that. Pay attention to those small details, and work some of this in, and you're checking both boxes. And I wonder how much, now that you say that, some of these like mass inflammatory responses that people come in and they're like, man, my joints are hurting. Did it just take so much of their immune system to deal with these allergens? And now, they, like you're talking about, that glass has gotten half full. It can't keep some of these other issues at bay.
Yeah, it's really hard. A lot of people have like they have a lot of inflammation and it's hard to backtrack and yeah, but you can do it. It's definitely doable. So you just have to take it one step at a time.
Fantastic. Dr. Shuba, where can people find more about Alarmy? Where can they follow you? I know y'all put out a ton of really helpful information online. I certainly learned a lot just kind of digging into some stuff, but where can people get in touch with you?
Look us up. My name is Shuba Iyengar. I'm the Chief Medical Officer at Alarmy. Alarmy is a company where we're able to, compound nasal sprays for people who have seasonal allergies or other kind of nasal symptoms. It's www.alarmy.com. Allermi, spelled a little differently. My kids always mispronounce it. But yeah, definitely check us out. We have a lot of really good educational content. It's really important to us. We want people to really live their best lives, be able to, really enjoy, nature and, everything. And so definitely, yeah, check us out. We have some really good educational stuff.
Can people just go straight through y'all to get that stuff? Do y'all mail some of the medications and stuff like that?
Such a good question. So the way it works is that if you have bad seasonal allergies, you just go on to our website and we have a really detailed questionnaire. It's 10 minutes. You just fill it out. And then based on your symptoms, we have physicians who are able to order certain formulas for you. So we're able to compound nasal sprays that contain 3 to 4 different things depending on what your symptoms are. And that spray gets delivered to you or mailed to you. And every couple of weeks we check in with you, see how you're doing, make sure that it's working well. And if it's not, we can always change the formula. So that's the beauty of it. Because you change, we're all different, right? And it doesn't always stay the same. And so we can change that formula every month depending on how you're doing.
Brilliant, brilliant. I love it. And thank you for what you do. I know balancing, sharing content and talking about these things with seeing patients sometimes seems like you're kind of chasing your tail, but I really appreciate you kind of, putting information out and taking the time and energy to educate people on some of this stuff. It really is helping a lot of people. So thank you for what you do.
Oh, yeah, absolutely. It's such a pleasure. It was lovely to meet you too.
You too. Dr. Shuba Iyengar, thank you so much for joining us.
Nice to meet you. Have a good rest of your day.
You too.